Production and distribution of City Club forums on IdeaStream Public Media are made possible by PNC and the United Black Fund of Greater Cleveland, Incorporated.
Good afternoon, and welcome to the City Club of Cleveland, where we are devoted to conversations of consequence that help democracy thrive. It's Friday, May 31st, and I'm Habiba Rashid Grimes, CEO at the Positive Education Program and a member of the Woodruff Foundation Board of Trustees. It's my privilege to introduce today's forum. According to the Substance Abuse and Mental Health Services Administration, more than half of suicides are by firearm, and nearly 90% of suicide attempts involving firearms are fatal. This is compared to only 5% of all other suicide attempts by other means. Suicidal ideation, or thoughts of suicide, thinking about suicide, to action can be as short as 10 minutes. Making access to lethal means a key focus in tackling increasing suicide rates in our communities. Recently, the Center for Health Affairs launched the Social Determinants of Health Innovation Hub, which aims to address structural racism, poverty, and behavioral health crises. In their work, they found a correlation between suicide by firearms and historically redlined neighborhoods, poverty, and race. Analysis also showed that firearm suicide among youths as young as 12 years old are rapidly increasing in Northeast Ohio. Highlighting the critical need to address structural barriers such as unemployment, lack of housing, lack of reliable and affordable transportation, and inadequate access to culturally responsive mental health and addiction services. Today, we will hear from leading experts about the ways we can improve suicide prevention and increase mental health resources for our most at-risk communities. Joining us on stage are Charise Briggs, Suicide Prevention and Community Engagement and Partnership Coordinator at the U.S. Department of Veterans Affairs. Tony Coder, Executive Director at the Ohio Suicide Prevention Foundation. Erin DiVincenzo, Director of Prevention and Children's Behavioral Health Programs at the ADAMHS Board of Cuyahoga County, and Daniel Lettenberger-Klein, Chief Executive Officer at Stella. Moderating the conversation is Brian Lane, President and CEO at the Center for Health Affairs. If you have a question for our panelists, you can text it to 330-541-5794. That's 330-541-5794. And City Club staff will try to work it into the second half of the program. Before we begin, I want to acknowledge that the subject matter of firearm suicides may be disturbing for some members of our listening audience. If you or someone that you know is experiencing feelings and thoughts about suicide, we urge you to dial 988 to seek support. A veteran crisis line is also available by dialing 988 and then pressing 1 to be transferred to Veterans Assistance. Now, members and friends of the City Club of Cleveland, please join me in welcoming Charise, Tony, Erin, Daniel, and Brian. Brian?
Well, here we go. Well, thank you all for being here today. We have a pressing and complex issue before us, one that requires insights from various sectors of our community, thus our robust panel here. Each of you brings a unique perspective that is crucial for addressing the intertwined challenges of both structural inequality, mental health, as well as firearm violence. The subject matter on firearm suicides may be disturbing, as has been announced to you before. If you or someone that you know is having feelings and thoughts about suicide, we urge you to contact 988 to seek support. A veteran crisis line is also available at 988, and select 1 for being transferred directly to the Veterans Assistance. We currently do have a healthcare professional in-house today if you need to speak with someone immediately. So according to the Substance Abuse and Mental Health Service Administration, more than 1/2 of the suicides are by firearm, and nearly 90% of suicide attempts involving firearms are fatal, compared to 5% of all other suicide attempts. So with that, what I'm going to do is I'm going to open it up for the questions and dig into the specific individuals for their inputs around our findings. So with that, in our research, we initially focused in on firearm violence and behavioral health with our SDOH hub, and we pulled data from 2017 through 2022 from the Cuyahoga County Medical Examiner. And during this period, we found that there were 1,006 suicides within the county. And of that total suicides, 535 were with firearms. 535. So the analysis found firearm suicides counted for 58% of all suicide deaths among residents of Cleveland and Northeast Ohio. And that is 8% higher than the 50% status on a national level. So firearm suicides among African American males are even higher, at nearly 70% of suicide fatalities. Further, the analysis finds that these alarming high rates of deaths by suicide, especially among adults under the age of 30, are acts of despair due to long-term poverty, lack of stable housing, unemployment, and access to transportation. Higher rates were identified in 3 primary zip codes as an opportunity to exchange or engage and focus interventions within these neighborhoods, which are ongoing. And thank you to Scott's team for some of that work. 44102, the Detroit Shoreway. 44105, which is South Broadway in the Slavic Village. And then 44108, Glenville and Forest Hills. So we're going to now open it up for those questions. And I'm going to start with Erin and then go to Tony. If you wouldn't mind, please provide the audience with additional information related to the prevalence of youth as well as adolescent suicides and the scope of the problem from the county and a statewide perspective.
So to begin, it's been identified that within our county specifically, it's an increasing need for youth to have an awareness of youth prevention, especially around suicide, but it's also behavioral health in general. We're seeing it become the second leading cause of death for children statewide. Unfortunately, our county was also identified as having higher rates of suicide, and we were actually invited to apply for a grant for youth suicide prevention, which we were awarded for our county's Suicide Prevention Coalition. So unfortunately, it really is a growing need. There's thought that it might be related to COVID, of course, the pandemic, the closing of schools, the closing of communities, the closing of all those things that help create that village around children. That isolation, lack of ability to create connections and be with others, it was thought to increase that sense of hopelessness and helplessness that's sometimes accompanied with suicidal ideation and thoughts. So first and foremost, as prevention, we always want to create that outlook that there is hope, there is a chance, and that there are people to contact for help. So I think in general, we are seeing that is an increased need. Something that's unique and unusual is that we're also seeing higher rates, like you said, using firearms. And something that's happening right now with some of the struggles around workforce is that in some communities, unfortunately, it's easier to access a gun. than it is to access the services that you might need to help prevent those thoughts and feelings from taking an action. That unfortunately it's hard to prevent that action from becoming fatal. So that's pretty much the scope of the problem for where we are now. But I'm the director of prevention for a reason, because I always believe in resiliency and hope, especially when there's a chance to include and envelop a community around children, because that's what children and youth need for support and growth.
Tony?
We lose 5 people a day in Ohio to suicide. We lose a child every 34 hours to suicide. I've been to a lot of funerals, and I work, quite frankly, in our environment that we have in the state of Ohio, and quite frankly across the country. We have to have better conversations about firearms in this in our society. One of the things that we do at Ohio Suicide Prevention Foundation is we actually work with gun shops on how to help identify folks who might be suicidal. Are there signs? We encourage safe storage. I do go to a lot of funerals, and one funeral of a 13-year-old little girl who took her life. The parents did not secure the firearm, and it was a very quick decision. It was within a few minutes. So we encourage safe storage to not just, we know that firearms are often used for protection and things like that, but having just that extra barrier has been shown by research to be able to help save lives. Right. So why don't we encourage that? Have open conversations. That was the most shocking thing that I found working with gun shops, how open they were. They don't want to lose people to suicide either. So how do we encourage those types of conversations and stop getting this into this political debate of I'm pro-gun, I'm anti-gun, and those types of things?
That's great. He deserves that. That's very good. Daniel, first let me thank you for working with the Social Determinants of Health SDOH Advisory Council at the very beginning of our work in 2022, 2023. As the co-chair of the SDOH Behavioral Health Work Group that helped lead the work in addressing the link between firearms suicides and conditions like long-term poverty and unemployment, what role can substance use programs play in not just treating addiction, but also in being a part of a much broader strategy to combat these underlying social determinants, particularly for people living in historically redlined and under-resourced neighborhoods?
Thank you, and it's an honor to be here today, and thank you to everybody who's here, because it's a very neat room of people. There's a lot of providers, there's a lot of support, a lot of funders in the room that have made this issue, while it is great and something we need to be talking about today on this stage and talking about outside of this room, there's a lot of people in here for a reason, so thank you all. The behavioral health care system was strained prior to the pandemic. We knew that there was a demand for funding, there was a demand for access, there was a demand for providers, there's a workforce shortage. We've had a number of barriers to access for a long, long time. And so for whether it's an addiction treatment provider, behavioral health provider, ultimately continuity between providers, between systems makes the difference, right? We can be doing great work, but if it's uncoordinated across the county, across the region, it's only as good as the person forgetting or not picking up the phone and making the referral or doing the follow-up call. So a coordinated behavioral health care system is something that is essential. It is something that is challenging. There is no universal answer to make it simple. It's complex, and there's a number of people like the ADAMHS board in the county and so many others that have worked diligently to try to create those connections and make sure that we have access to one another and are held accountable to access to one another. But ultimately, we need to do a better job as providers to leverage the care we provide and the network we have to make sure people don't fall through the cracks. And with that, it's not just making sure the people we're caring for that want to get well have a referral network that's talking, but it's data sharing. It's knowing what's happening in each neighborhood, knowing that in these zip codes we need to do a better job. I need to know what's happening in that neighborhood so that when somebody hits our door at Stella Maris from that neighborhood, we know what is accessible when they leave, what is not accessible, what we need to refer to, and how we make just an integrated network for everybody that comes to get well or wants to get well or doesn't know yet how to get well. And the SDOH Hub has been a really wonderful project, and thank you to the Center for Health Affairs for being brave enough to do the work and getting everybody together, because we've got 260 partner organizations working on this project at different levels, and so it really shows that when we come together, we can start to have a conversation. But now it's time for more action, right? And all of us need to do something with the platform we have, and make sure that we have something that comes out of the discussion. Make sure we include the people that we're talking about in the discussion, and make sure that we are working in a direction of trying to lift the entire community, because we know that suicide is preventable, right? So I think platforms like this help to make that change. So thank you.
Thank you. Erin, I'm going to come back to you quickly here. The cycle of poverty and lack of opportunity can lead to the utmost despair. What are some community-based programs or initiatives that our community can support and rally around, that can empower youth, build resilience, and provide them for hope for the future?
And thank you for the reminder. I was so nervous I forgot to thank everybody for being here, and the honor it is to be speaking here, and humbled by the topic. I think the first thing about resilience is that all children and youth and humans have inherent resilience within them. Some of the things that get in the way of that resilience is limited access to all those basic needs that we need to survive and create a stable, connected, safe community for not only our families, but for all of our families. We are just so interconnected, and we have to realize that, while we are an individualistic society, we do have to come together in order to really solve some of these big problems, like you were saying, with having a coordinated system. We are very fortunate to have a lot of resources and services here. We have a great network of providers, all have a front door access to 988, who not only is crisis, but also referral and linkage. We have school-based prevention and consultation programs in over 200 schools that can provide support not only for teachers, but also our students. A lot of our behavioral health prevention focuses on youth-led prevention. Many of those providers do a wonderful job and have been doing it for years. And more recently, we've supported bringing Youth Move back to our community and our county to kind of bring some of those youth-led prevention groups together. Unfortunately, our county was also identified, like I mentioned, as having that increased need. But fortunately, we were granted that award through our Community Suicide Prevention Coalition, which is open to the entire community. Anybody who is interested and want to be a part of that is more than welcome to come and become a part of that initiative. We do have 2 providers that are leading that grant, which is going to be a small pilot program focused right into Cleveland at a couple rec centers that will be focusing on youth prevention, targeting specifically Black and African American youth whose numbers of deaths by suicide have been increasing and I'd be remiss if I didn't mention also the youth-to-youth homicides that are occurring in our county, because to me there's a similar feeling therapeutically of that loss and that despair, and that I think goes with that impulsive act with a gun. So we have a wealth of programs and services, but I think more than anything, our youth and children really need to know that everyone cares. So if anybody has a child or has a youth around them, or an adult, stopping and listening, checking in on them, seeing how they're doing, getting them involved not only in behavioral health or mental health, but also making sure that, are they accessing their physical health care? Are they, reaching out? Are they able to identify all their needs? That's kind of where resilience starts. Making sure we have our physical health and everything else in place can help us create that. And access to opportunities for our youth as well. To do positive things and feedback, and that's one of the reasons why there are so much youth-led prevention. So there's so much that we can do to really encourage and facilitate youth resiliency, but they do need adults to model and be role models too in that as well.
Thank you. Charise, I've got a question for you. You ready?
Yes.
All right. Given the high rates of firearm suicides, particularly among African American males, and considering the unique challenges faced by veterans, such as PTSD and reintegration into civilian life, which is tough in itself, how can the broader community work with the VA in addressing the behavioral health needs and socioeconomic conditions that contribute to despair? It's a big one.
It's a big one. And in an effort to not say the exact same thing that all the other panelists said, I will echo a few things that really just come to mind, because this is not only my role with the VA, I work with community providers specifically, but I'm also a veteran. My oldest son is an active duty military member, so this is also very much a passion for me. One, what Tony mentioned about being able to have conversations about firearms, being able to identify that safe storage means different things to different people, and we need to be sensitive to that. Firearms are here, they're not going anywhere. We can stay away from the Second Amendment stuff and just have conversations about what we're working with, and that's what we need to do. So a big part of our work that we do with suicide prevention at the VA is training in the community, training with our own providers also, but in the community with how to talk about how to secure firearms when we need to. In regard to other things that were discussed, peer-to-peer work, we hear a large increase in the need for it, and that's a big part of these conversations. It is important that community members not just know all the information, we know data, we know statistics, many of us can speak eloquently to it, but we need to really work on being able to have conversations with people who are in crisis. So that's a large part of what we're doing, is we're supporting the community in being able to have these talks with service members, with veterans, and their family members. We want to identify those individuals. We want to make sure that we are all connected, so that ties in with the importance of the consistency and collaboration. We are not going to solve this problem in silos. We must be connected. We have to talk. It's not an us versus them anymore, and us all being in the room together proves that, shows that. We all have this common interest. So, in relation to veterans, the VA is now taking a very aggressive stance in making sure that our community has access to training. I can provide my information. I have a colleague who also does similar work in the community. We support 21 counties in VA Northeast Ohio Healthcare. That's over 14 facilities for veterans, and also doing work with some of their families as well. So we want to come into your organizations. We want to have conversations with your staff that talk to veterans. We want to train. We want to make sure that our community knows what to do when things are risky and talks need to be had. So I think I addressed everything.
You did. You did great. All right. This is going to be my last question. That means that all of you need to start be thinking of all of your questions. All right? If you know that's what, you know me, this is how I prompt people, right? So, Tony, I'm going to ask my last question with you. So data shows a high rate of firearm suicides correlated to historically underserved communities impacted by structural barriers, especially among young adults. How can healthcare leaders and policymakers support proactive solutions that address root causes that lead to despair and hopelessness?
I think it goes way beyond even local leaders. I'm going to get grouchy here. I was in D.C. Last week talking to Congress. Why have we not spent $3.4 billion in mental health care? It's sitting in the federal government. why have only 17% of the funds to support 988 been sent out to local providers? I don't think this is a provider. I think this is, we've got to get our heads out of our keisters in DC level and start talking to each other. We've got to have conversations. We've got to have conversations and stop focusing on politics and instead focusing on the issues that matter. 130 people in this country are not going to see a sunset tonight because they're going to die by suicide. We need to stop that in this country. Instead, we're focused on all of these other things. So that's where I'm going with that. I almost forget the question because now I'm fired up. But local providers, I think we also need to expand, we need to recognize that, we have peers that can serve individuals in the state. That, from a very personal level, I'm in this because my son is a suicide attempt survivor. And I went from the policy world to a real world, and it's entirely different. I can talk about policy, and I can talk about things that need to happen, but when you're in that moment, he needed someone to listen right then. What happened to him? He was at a job. He drove himself after his attempt because his boss didn't know what to do. He sat in an emergency room for 2 days. I had no idea where he was at. We need to do better with our providers on the physical health side to help. How do we make sure that we make those connections? He called me from a mental health facility and spent 13 days there. We need to do better as a system, as a healthcare system, because this is a health issue. This is not a character issue. This is not an issue about where you grew up or anything else. This is a health issue that we should all be involved in. So everybody needs to care about mental health care and suicide. So if we can get all of our providers talking and working with one another, we can get peers involved, we can get nurse practitioners, we can get these folks wherever they need to be. That's what needs to happen, instead of, I don't know what to do next. So, sorry I'm fired up.
No, that was great. That was wonderful. All right, well, I'm going to wrap things up here. The Social Determinants of Health Hub, in conjunction with Amazon and AWS, recommends increased access to behavioral health services, just like Tony stated, especially in school settings for our rural populations and historically underserved communities, along with efforts to increase the diversity of the behavioral health workforce, which hasn't been mentioned here, but I want to put that into our conversations. Long-term recommendations include enacting policies to improve upon economic mobility, encompassing basic income, childcare, climate change, digital access, education, food, green space, housing, jobs, tax credits, and transportation, as well as policies that support and stimulate the economy of Northeast Ohio. Before we open it up to the audience Q&A, are there any closing remarks from our panelists today? Start with Daniel.
Yeah, I think, thank you all for everything. I love the fire. That's awesome. And it's absolutely necessary. I think for the provider network, I don't think that we're not working hard enough. I think the trouble is how we work smarter, how we use technology to leverage what needs to happen next, and really making sure that we have a community-driven approach to how we care for people, because having the providers assume that care needs to look a certain way is one of our greatest detriments. So having the community that we're caring for involved in care delivery and care creation, treatment planning is essential. And I didn't mention it, but with Stella, right, the intersection of substance use, misuse, or dependence and suicide is real. And so when somebody, whether it's a young adult, an older adult, is struggling, access to care in real time matters. We talk about the window of willingness to get well. If we don't have the networks and the access and the systems in place to make sure that while that window is open, we can get somebody to where they need to be, we lose the chance and we lose the person. And very often the ripple effects within the family are generational. And so we need to be thinking about children and parents and loved ones and friends, family. It affects communities, not just families, not just individuals and systems. So thank you.
Thank you. Erin?
I think first and foremost, when I think about children, youth, and adolescents, what we need most is safety, security, and opportunities for positive experiences. Building off this fire, absolutely, there's no need for all these guns in our community. And there's very little being done about that. And I think that's first and foremost. First thing you do to make sure a child is safe is you supervise their environment and make sure that anything that they could potentially do to hurt themselves is not there. Mm-hmm. And that's just common sense for toddlers. And as we get older, we learn how to be safe in our environment, but it still is the responsibility of the adults around our children and adolescents to create a safety net, a safe community where they can go down the street, they can play in a playground right down the street. Little things like that make a huge difference, and there's many communities in our community that don't have that. Neighborhoods that don't have access to simple, everyday things that can make a world of difference, but they're not simple if you don't have them.
Thank you. Tony? They're ready for you.
I encourage every one of you to be a suicide prevention advocate. I encourage every one of you to know what the signs are, to know what to say. There was nothing scarier than Saturday morning at 8:07 when I received that call from my son within the mental health facility. I didn't know what to do, and I'd spent 20 years in it. I thought I knew everything until it hit me. Be prepared. Make sure that you know what to do, where to go, whether that is whether you have a mental health provider, 988, your local church, whatever it is that you might want to refer somebody to, and sometimes it's just good to listen. Suicides were like at a decade low in 2000 and 2020. Why? During COVID. We're locked up. What happened? Because if you remember the messages back then, go check on your neighbor. Go make sure that they're okay. Go do those simple things like that. Dr. Thomas Joyner, who's one of the grandfathers of suicide prevention, said, suicide is the perfect intersection between loneliness and burdensomeness. If we can help by helping someone feel heard and not a burden, we can all save lives. So thank you so much.
That's really powerful.
It is. That was.
So in closing, certainly very honored to be here. I never said that, so of course I think that's a given. I think the most important thing that we can all do at this point is just to begin. So we have this information. It's a Friday afternoon now, and I think we need to be very aggressive about making a plan with ourselves to become trained in how to have these conversations. If it's something that you want to stay away from, at least know the resources, but know what to say when these circumstances present, because it might be that someone is coming to check in with you because they need help. So being able to identify the signs of increased suicide risk are very, very important. But the most important thing that we need to do is to actually begin to do this work.
Thank you.
Thanks.
Thank you. All right, well, we're about to begin the audience Q&A for our live stream and radio audience, or those just joining. I'm Brian Lane, President and CEO for the Center for Health Affairs and moderator for today's conversation. Here with me today is Charise Briggs, Suicide Prevention, Community Engagement and Partnership Coordinator at the U.S. Department of Veteran Affairs. Also with her is Tony Coder, the Executive Director at the Ohio Suicide Prevention Foundation, and Erin DiVincenzo, the Director of Prevention and Children's Behavioral Health Programs at the ADAMHS Board of Cuyahoga County. Along with all of them is Daniel Lettenberger-Klein, the Chief Executive Officer at Stella. We welcome questions from everyone. City Club members, guests, and students. Give praise to the students in here. Thank you. And those joining via our live stream at cityclub.org or radio broadcast at 89.7 WKSU. Idea Stream Public Media. If you'd like to text a question for our panelists, please text it at 330-541-5794. That again is 330-541-5794. And City Club staff will try to work it into the program. May we have the first question, please?
Hello. Our first question is a text question. It says, let's talk about the prevalence of suicide, suicide attempts, and mental health of our LGBTQ plus community. With the Pride Month coming up, we know that this is a major priority to address in the LGBTQ plus community. What trends are you seeing, and what are the best supports out there to meet the unique needs in light of the current political climate in Ohio and our country?
Yeah, that's a great question. One thing I was remiss to mention is that the grant that we have is not just for African and Black American youth, it's also for LGBTQ plus youth as well. Especially the intersectionality of those two populations is where we're seeing the greatest risk for youth. So that's where we wanted to do a targeted pilot intervention to try to see if we can address those needs. Within Cuyahoga County, we do have a few providers who do specialize in LGBTQ plus services. So we are fortunate that we do have that, but yes, it is a growing need. Specific data and prevalence, I don't want to speak to that offhand, but it is growing and it's known. Again, it's that isolation and that fear of not being connected or unable to be yourself in some way, shape, or form. So creating communities around everyone to allow them to be themselves and to feel like there's no reason to ever have to end your life. There's always something and something more greater. And we are all we're all supposed to be here.
And there are some great resources. I know we just literally last year created a campaign called To Be Me at the Ohio Suicide Prevention Foundation, which is focused on LGBTQ suicide prevention. We want to encourage you be you. Be proud of who you are. We don't say that enough, I don't think, to our kids, no matter where you're at. Be proud of who you are, what you bring to the table. Also, the Trevor Project is a great national resource for LGBTQ young people, especially in our country. They even have an LGBTQ lifeline that you can call. Also on 988, if you press option 3, that goes straight to an LGBTQ helpline. We want to encourage those things. There's a national trans line. We want to make sure that every life matters in this country and in this state. So how do we get those resources out? We need to make sure that that folks feel valued and that they know where to turn, because sometimes folks are not the most friendly. And we need to make sure that we send them to safe spaces, to friendly spaces, and spaces that will support them to save their lives.
I will mention one, the LGBT Center of Greater Cleveland is an exceptional resource, and so everybody should be familiar with it. Go visit, go see the space. Again, my primary work isn't in the suicide space, but it is, there's some intersection for sure. And just the rates of a lack of safety, specifically for the transgender community, transgender youth, just the LGBTQ plus community in general. We, not to get political, but are in a climate of divisiveness, right? It's very dangerous just on the streets in our community to identify whether it's on our streets or on the internet. We are in an epidemic of loneliness, as we've mentioned, and disconnection as a result of cyberbullying and isolation. It is exceptionally dangerous right now, both online and offline, for members of the LGBTQ plus community. And that only changes with all of us. That only changes when, as a community, we create safety in every corner with every provider and in every building, every school. And that starts with community conversations. That happens with the school systems. That happens with our government entities. There needs to be, we need to think about what we're willing to stand up for and what we're not willing to stand up for. And what we're not willing to stand up for, we need to know why. And then we need to be looking at those ideas and beliefs in the face and thinking through what lives are saved through bravery and voice. So
in regard to veteran support, it's important that we're open and that people, that our veterans are aware that there is support available. We have a LGBTQ plus care coordinator who works very closely with our suicide prevention team and our healthcare system as a whole, who's able to assist, navigate. We have our GIVE clinic, which stands for Gender Identity Veteran Experience, which is specifically for veterans who identify. We are changing the culture within our system, and it's important that our public, our community, and our veterans know that support is there.
Ready to take the next question?
Hello, my name is Kyle. I am a sophomore at MC Squarestem High School, and I wanted to know that, do all of you agree with this statement that we should try to change how interacting with mental health professionals is portrayed in the media? Because, like, before I met my amazing counselor, I thought that I thought that if I tried to talk to anybody about my mental health, it would be like, oh, well, we're going to send you to a home, and now you're never going to see your family again. And it's like, oh, I don't want to deal with that, so I just don't talk. So by having those resources available, that will help, bring down the rates of suicide, not just with guns, but in general. So do you guys agree with that statement?
Yeah.
I do.
Yeah. Yeah.
From my past experience working with youth, I found it to be, even though we worked with tough stuff, I always tried to make it be joyful and create humor and laughter and play involved, even when I was working with 18-year-olds. Somehow, some way, shape, or form, some kind of play. Because that's how children learn best, is through laughter and learning. And that's also how we induce healing, is, to create that ability to, connect over something that, is playful. Because even though we might be going through some tough stuff, that's a lot of what coping skills and resiliency is all about, is, trying to see, notice that there might be a beautiful tree outside, even though it might have some, broken limbs, dead limbs that have been cut off. I mean, it reshapes and it forms and it grows towards the light. Even the solar eclipse, it only took like a tiny, tiny sliver for all the light to shine through. And that's all that it really needs for children and youth and all of us to come back. So 100%, don't be afraid to talk to behavioral health providers. I think behavioral health providers get a bad rap too. And sometimes behavioral health providers need that light and levity too, resiliency and growth, and we all need to take care of ourselves, and that's really what it's about, right?
Yeah, we have to let that stigma go.
Yeah,
Right?
yeah.
I would love, it was a great question.
It really was.
And I'm a marriage and family therapist, so I have to focus on the family system. And so for that, media matters, obviously, but the conversations in the house matter more. And so ultimately, we're in a Rust Belt city in a tough area where we pride ourselves on our toughness and our grit and getting stuff done. And until, I think it starts in the schools personally, but and the community centers and all of that. But until the narrative is consistent in that accessing resource is a strength, not a weakness, seeking help, sharing vulnerability is a superpower, right? Until we get to that place, community-wide, family-wide, it will always be that we look to the media to inform our fears. And so it's all what's happening in the home and in the community, I think, that can really drive the messaging on what support, safety, and well-being look like.
And I think I'm going to give you a hug later if you're okay with it. That was a great question, because the stigma is really, it really is an issue. 80% of our suicides in Ohio are middle-aged men. And why do we hear some of the reasons? It's because there's a misunderstanding about what the behavioral health system is. They automatically think that, oh, I'm going to be in a straitjacket, in a rubber room, and all of that kind of stuff. The things that media can portray.
Next question.
Sure. Mr. Croder, I'm glad your son was able to find a brighter day. But scarcely a day goes by that I don't reflect that the child I was tasked by juvenile court to help could not see a better day, found a gun and shot himself. And so I have had twice an opportunity to go down to Columbus to talk about what are called red flags laws, in which people would be able to go to court and to offer testimony and say that somebody is a risk to themselves or others, and then they would they would remove a gun from a household and then have hearings as to whether the person was a danger to themselves or others. And if there were a danger, they would hold the gun and refer the individual for counseling and other services. If they were not, they would return the gun. I wonder if your panelists have any experience with red flags laws and whether you want to comment, because it's not just an issue about schools in Florida, it's not just an issue of movie theaters in Colorado, but the data from Connecticut and Indiana suggests that it discourages suicide as well. So I wonder if you have familiarity with the red flags laws and whether that might be a good option for Ohio.
I do know about red flags laws, and here is, and this is from a very personal issue, a very personal standpoint. I do believe that there should be background checks and some of those things. My fear is the discrimination piece. Look, I know that this is not popular. My son can't get TSA pre-check because he spent time in a mental health hospital. That's discrimination. He got help. He got the care that he needed. So to be able, I'm worried about that slippery slope. I'm concerned about what that would do to folks. And look, I encourage folks that if you're not feeling safe, if you have someone in your house that's not safe, give your gun to a friend. Give your gun to the gun shop or wherever. We have to work in political realities, and red flag laws have been tried numbers and numbers of times, and they just don't work. So we have to work in the political reality, and for my son's sake, I worry about the discrimination piece.
Anybody else?
I just want to speak to that, how quick it can happen. A lot of times with children and adolescents, it really is so quick. And that's where we come back to that concept of like delay, delay, delay. The longer it can take for somebody to have access to something that can kill themselves, the more chance they have to have a different thought, have a different idea, have somebody else come in and help them choose a different path. And so anything that we can do to delay that action is what we want to see happen. How the best way to do that for Ohio, I don't know. But we can delay, delay, delay. Between that thought, that idea, and having means to complete that action is what we want to see happen.
So I don't want to be a broken record, but so with that, being able to delay, it's important that we know how to do that. Yeah. And how do we know how to do that? By beginning to have those conversations, by practicing having those conversations with someone in crisis. It only takes seconds. And as I mentioned earlier, safe firearm storage, safety is different for everyone. So we have to remove our bias, we have to remove our own personal feelings, and we need to focus on what needs to be said in these conversations, and we need to begin practicing them. So when these situations present, we know what to say. We're actually able to delay the action itself. So leaving politics out of it and just bringing the human into it, knowing how to have conversations, and it begins with us.
Anything?
I think I'll be the lone panelist who says, I don't know enough to answer the question because they know way better than I do. But yeah, I think a means to control and create safety matters. I don't know enough about red flag laws to answer competently. I'm sorry.
Next question.
Hello, I'm Eliana Gorman. I'm also with MC Squared STEM. And how would a kid or like a teenager talk to their parents about mental health or about suicidal thoughts when it is so stigmatized?
It is.
I think they're all looking at the child therapist for that one. It's really hard to know because it really depends on what your relationship is with your parent or the adult. I think the best way to start is to try to pick somebody who you feel comfortable talking with. And if you don't feel comfortable talking with that person, well, just start talking. You know, try to find somebody who will listen. And for the adults in the room, if a child or adolescent comes to talk to you about something that is related to suicide or about their mental health, please try to stop and listen. It sounds so simple, but that's so hard for the adult life. We have all those things in our mind going on, all those things on our to-do list. We're multitasking all the time. But when a child or adolescent starts to bring up this topic, it's worth our time to stop and listen. And I think that's my message to the adults in the room. For the kids, I think just start talking, and hopefully the adults around you are going to listen, because that's what we need to do. Adults need to listen to our children and adolescents as much as we can.
One, find a trusted adult. If it isn't your parent, you know, is there an aunt? Is there a teacher? Is there a professor? And to your point, quite frankly, I thought my son was just going through a phase. That doesn't happen to me. I did this, I did that. The adults have to listen. So if your parent's not listening, then find a trusted adult who will listen and let them help, maybe even guide you in that conversation with your parent. Maybe they go with you and say, hey, you know, my child, or, you know, what was your name again, ma'am? Eliana. So Eliana is struggling. I'm here, I want to support her, and we want to have a conversation. So even if it isn't your parent, I think just making sure you tell somebody. And then as that adult that maybe could be trusted, then take that adult with you to have that conversation.
I think there's a lot of, for parents more so, a caregiver in any way, whether it's a parent or not, we, not to soapbox it, but like are so distracted all of the time, right? We've got so much stimulation all around us. We have our phone in front of us. We have headphones in so easily now that we can't even, so I talk to people all the time when they have earbuds in. I have no idea they have earbuds in. It's so easy to be disconnected that it's such a necessary skill to be aware. And so just watching for signs and symptoms of a difference in behavior and a difference in how shy somebody is, whether they're speaking, what their dress looks like, how they're eating, their speech, it all matters and it all needs to be seen. And so from the caregiver perspective, understanding what to look for to see behavior changes that need to be a cue to check in. But also I think it's really important to use the one resource I was railing against, which is the internet. There's a lot of good resources on like how to start the conversation, how to say what to who, and what a care system can look like. Providers need to be in the same space. So it's really important to know exactly, what your support system can be, and if you're not sure, just asking. And then if it's through text, that's better than nothing at all. If it's in person, better than texting. If it's on the phone, you know, it is what it is as long as it's support. So there's a lot of different ways to access care.
Thank you so much to Charise Briggs, Tony Coder, Erin DiVincenzo, Daniel Lettenberger-Klein, and Brian Lane for joining us at the City Club today. Thank you so much for being here. I'm Cynthia Connolly, Director of Programming here at the City Club, and forums like this one are made possible thanks to generous support from individuals like you. You can learn more about how to become a guardian of free speech at cityclub.org. Today's forum is in partnership with the Center for Health Affairs, with additional support from the Woodruff Foundation. Thank you to each of you for making today's conversation possible. Also recognizing that today's subject matter may have been difficult for some members of our listening audience. If you or someone that you know is experiencing feelings or thoughts about suicide, we urge you to dial 988 to seek support. Our veterans can dial 988 and press 1 to be transferred to a veterans assistance. We would also like to welcome our students joining us from MC2STEM High School and the Cleveland School of Architecture Design, as well as our guests at the tables hosted by the Academy of Medicine in Cleveland and Northern Ohio, the ADAMHS Board of Cuyahoga County, Bay Partners Philanthropy, Case Western Reserve University, Medical Mutual, Ohio Guidestone, the Center for Health Affairs, and the Woodruff Foundation. Thank you all for being here today. Next week at the City Club, we will welcome Dan Kerr, Assistant Professor of History and author of Derelict Paradise, Homelessness and Urban Development in Cleveland, Ohio. Sam Allard from Axios will moderate a very important conversation tangential to one today. And you can learn about this forum, get your tickets, and learn about others at cityclub.org. And that brings us to the end of today's forum. Thank you once again to our guests, our members, and friends of the City Club. This forum is now adjourned. Have a great weekend.
For information on upcoming speakers or for podcasts of the City Club, go to cityclub.org.
Production and distribution of City Club forums on IdeaStream Public Media are made possible by PNC and the United Black Fund of Greater Cleveland, Incorporated.